Sleep apnea. 20% of people have it, and contrary to popular belief, gender, age, nor weight have anything to do with it. It's like trying to find a quarterback for the Texans, or a president for this country. Anyone's a candidate. For over 12 years, I've educated thousands of people on sleep apnea as a sleep coach and the owner of a CPAP store in Southeast Texas. But I find there's still many who don't know about it or have misconceptions. So let's dive into what sleep apnea is, how you diagnose it, and of course, how you treat it. First, to do away with a common misconception, snoring doesn't cause sleep apnea, but is one symptom of it. That's why the general rule is not all who snore have sleep apnea, but all who have sleep apnea snore. Apnea literally means without breath, or to stop breathing, and these events can occur for anyone whose throat muscles are large enough to block or obstruct their airway when those muscles relax. I'll say that again. Apneas can occur for anyone, yes, even babies, whose throat muscles are large enough to block or obstruct their airway when those muscles relax. That's why you'll most often hear about obstructive sleep apnea, or OSA for short. And it's super common, maybe more common than you think. Imagine you've just started dozing off, or you're starting to reach a deeper level of sleep when all of a sudden, that's the sound of an apnea. And you could be having several at night, greatly impacting the quality of your sleep and life overall. That's because with every apnea, your brain wakes you up for literally a millisecond so that you can take a sufficient breath. The most that I ever saw was 121 in an hour, basically meaning the patient spent 1/3 of the hour not breathing. Now think about the effects that has on your body. Your brain isn't getting enough oxygen, so your heart and lungs are working harder to get you what you need. I describe it to my patients as your body doing overtime. It's working harder when you're asleep than when you're awake, which is why so many people feel more tired after waking up than they did before bed. Studies and surveys show that about 20% of people experience such symptoms. In the US, that would equate to 72 million people with sleep apnea, yet only 22 million have been diagnosed. That's quite a gap. Sadly, sleep apnea is still one of the most underdiagnosed sleep disorders, despite all of the attention brought to it over the last 2 decades. And the main reason, in my opinion, is personal resistance, aka pride. There's this kind of stigma around sleep apnea, and I'll admit, I was guilty of choosing to stay uninformed at first too. I remember when my parents first told me that I needed to get tested for it. The only person I could remember having it outside of my dad was Meg Ryan's fiance on Sleepless in Seattle. You may remember he had the giant old school CPAP on his nightstand, and she left him for Tom Hanks. I wanted to be Tom Hanks, not the other guy. And I know a lot of people have similar images that pop into their heads when they think about sleep apnea. Or maybe you're thinking, it's bad enough that I snore. Or my parents just got diagnosed with this. How could I possibly have it at my age? Or here's the common one. How am I going to look to my partner? Well, you're going to look alive, and I'm pretty sure that's a plus for them.
Do you or do you not feel bonita?
I feel bonita.
Wonderful, because you look bonita.
But seriously, you've got to get past the stigma and all of the stereotypes. We're talking about a small sacrifice for a huge gain, and every bit of what it takes for you to fix the problem is minimal. It all starts with a sleep test, and thankfully, testing for sleep apnea is a lot easier nowadays. What used to entail you sleeping overnight in a hospital or sleep center, hooked up to a bunch of cords while someone watched you and gave you permission to pee, now just requires that you wear a Bluetooth-enabled pulse oximeter for a couple of nights in the comfort of your own bed. If you experience loud snoring, dry mouth in the morning, brain fog, or constant headaches upon waking up, or maybe you struggle with daytime sleepiness every single day, it's best that you talk to a doctor about getting a sleep test. The way the test works is that it reads your oxygen saturation. If it drops 90%, meaning it's 10% of what it would normally be, and it stays that low for 10 seconds or more, it'll be marked as an apnea. If you have 5 or more apneas in an hour, you'll be recommended to get therapy. Not treating OSA has a number of consequences you don't want. First, it weakens the lungs and worsens the length and frequency of your apneas, and that impacts your life even more. For example, we had a patient a while back who was referred to get a CPAP, but he decided he didn't want one. 2 years later, his nights had gotten so unbearable that he had another sleep test. His AHI, or average apneas per hour, had gone up from 14 to 32, which meant he went from a mild case of sleep apnea to a severe one in a fairly short time. Even worse, he developed hypertension over that 2-year period. Hypertension or high blood pressure is one of the most common chronic conditions that could be a result of not treating sleep apnea, and it goes on to create problems with heart disease, heart attacks, and strokes potentially. The effects on the brain are also concerning, with the lack of oxygen up there impairing cognition, memory, and focus. It could also lead to dementia or Alzheimer's down the line. For some, lifestyle changes like weight loss, not drinking late night alcohol, or stopping the use of sedatives can reduce the impact of sleep apnea. But for some, that's not enough, and that's when we get into the treatments you've likely heard of. Continuous positive airway pressure, or CPAP therapy, is most common, along with oral appliances like mouth guards. That's because they're non-invasive and can open up the blocked airways, which is obviously your first course of action. Surgery will always be the last resort. Doctors don't want to put you under the knife for a 50-50 chance that you'll stop having apneas, and you shouldn't want them to either. If you're diagnosed, hopefully lifestyle changes and wearable appliances will do the job, and please, whatever your doctor recommends, push yourself to stay consistent, having at least some type of treatment nightly, because life is way too precious. I'm Billy with Better Z's. If you learned something valuable here today, please help spread the word and be sure to smash the like button. Also, subscribe to stay tuned. We've got more valuable content and deals coming your way every single month.